Hi everybody, it's Susie again. It's Monday, December the 13th, and I am 3 months now post-op from my posterior lumbar fusion at L5-S1. So I'm doing a quick update on my video diary. I've got to run out the door. I'm going to have a massage today, thank God. So I just wanted to tell you, things are so much better. My life is so much better than before surgery. You know, before surgery, I just wanted to have that quality again, some kind of quality of life. I mean, I've been a hospice nurse, so like that's the big focus for me. I just want people to have quality of life, to be able to do the little things that, you know, that make them happy. And for me, that's being a mom, being in the kitchen, being able to take my son to do things. So anyway, I've been able to get my life back, and it feels wonderful. I still have my brace on, and I have a doctor's appointment. Well, I have an x-ray at the end of this week, and then I go to the doctor on Monday to follow up with him. So it'll be Monday the 20th, and I'll give you another update at that point. We'll see how the x-ray is looking. But in the meantime, the pain is so much better. The Lyrica was increased from 150 3 times a day to I take 150 in the morning, and then I take 300 midday and evening. And that seems to do the trick. I don't take any narcotics anymore. No more Vicodin, Norco, nothing like that. Sometimes I take Tramadol. And for the most part, I take extra strength Tylenol. Sometimes I take an aspirin. Rarely, if it's really bothering me, I'll take one naproxen or a couple Advils. I have to be really careful with the NSAIDs because of my stomach. I really shouldn't take them, but it does help the pain. I do still have a little bit of pain on the left side of my butt where I had the really, really bad nerve pain before surgery. I also still have some pain kind of over in my right hip. Yeah, right side of my butt, right hip, and my right thigh. Like if I do a lot of walking when I'm exercising, if I just do a lot, I will still get some pain there, but it is so much better. I mean, a couple weeks ago, I was pretty discouraged. So I guess what I want to get across on this video is, I mean, I heard that in the pre-op teaching, the doctor's notes even said, you will still have some nerve pain after surgery. Be patient, be patient. The nerves have to heal. Well, that's the truth. I was discouraged after my fall because I thought that even though the x-ray was okay, I thought surely I must have hurt something after the fall because I was having so much more pain. But that has settled down. So there is hope. It does get better. You can get your life back. Just hang in there and, you know, just keep going back to the doctors until you find the right one that's willing to help you. So that's my message for today. It's a quick update, but I'm able to, like I said, I'm able to take my son to do things. I'm able to get in the kitchen and cook. I'm able to drive, which is a big deal because driving was really horribly painful. So I can drive. I can go to the grocery store. I can go to Walmart. Granted, I have to get help carrying stuff to the car sometimes, and I get my son to help bring it in the house, so I'm not lifting all this heavy stuff. But, you know, I can clean out the refrigerator. I have to sit on a chair and clean out the refrigerator out to the counter. And sometimes when I load the dishwasher, I'll sit in the chair to get stuff in and out so that I'm not bending. And when I clean out the litter box, I sit on a chair. And I have my litter box elevated on a box. So I've just found ways to not be bending over. But, you know, people see me now and they say, my gosh, I can't believe the difference in you. You look like yourself again. You know, I went and got my hair cut and I got my gray colored, and I feel like getting a shower now. I can actually blow dry my hair and take a minute and put some makeup on. So, you know, it's just the little things that mean so much. I was able to take my son to a couple Christmas productions. My grandmother lives close by. I've been able to take her grocery shopping and to Walmart. And I'm trying to get the focus off of me and just get outside of myself and try to, you know, help where I can until I can get back to work. So hopefully in a few months I'll be back to work. Anyway, that's my quick update. Sorry I'm in a rush. I got to get out the door to get to this appointment, but I wanted to post something. And thanks again for your comments, your encouragement, and I hope that I can encourage you in some way. Hang in there and keep in touch. Thanks.